Welcome to Valley Fever Voices podcast. Today, I have the pleasure of speaking with Dr. Butkovich. She'll fill us in on the clinical trials and studies in dogs with valley fever that she's working on, and some that pet parents can even enroll in. So, Dr. Butkovich graduated from the Cummings School of Veterinary Medicine at Tufts University in 1998. She relocated to Tucson in 1999 and got a quick education on treating valley fever in pets. Currently, she works at the Valley Fever Center for Excellence at the University of Arizona and has a particular interest in the diagnosis and treatment of valley fever in companion animals. Thank you so much for joining me, Dr. B.
Thanks for having me.
Sure. Okay, so we've got a couple studies that are going through. Is it statistics that they're going through with this and trying to figure out
statistics and the write-ups we're working on.
If things are statistically significant. All right, tell us about some.
Okay, so I can update you on two. One is called the Interlab Variability Study. And what we're looking at is whether titers from different labs are comparable. And that's important because if you change vets or if your vet changes labs, we want to know if you can get the same result. So we enrolled over 60 dogs and we took one blood sample from them and then we split it and sent it to 4 different commercial labs. And so they were all run on the same day. They got back to us and we are still evaluating how significant they are, how close they are, but overall we found probably less agreement between the tests than we expected.
Wow.
Overall, it wasn't a good comparison. Some of the labs did a little better if you're just looking at 2 of them. So yeah, it was just the agar gel immunodiffusion. It's the same test that your veterinarian uses to test your dog for valley fever. And overall, what we have is we looked at all the labs together and the comparisons, and then we tried to define them by what we would consider a clinically relevant difference. So that is, so say one test negative at one lab and positive at another, that might change what the veterinarian does. Or if you get a 1 to 2 from one lab and a 1 to 16, that's certainly going to change.
So it's not just the titers were different, it was that some got a negative test and some got a positive test. That's really significant.
Yeah.
Wow. So when we have different titers, that's kind of gonna make a difference because a real low titer may be not as significant to some vets. But then having a negative test at one lab and a positive test at another lab makes a huge difference. So, so how does that happen? Like, how do they get a negative test? Is it just totally different technology that they're using?
So it's the same basic technology, but the test is run by, you take the dog's blood sample and you put it in a little well on a gel plate, and then you put your known reagents, your known antibody and your known antigen. And you're looking for a line between the antigen and the sample. And if it precipitates out and forms a little white line, and that takes 24 hours, then it's positive. And then what the labs will do is dilute the blood, and that's where you get the titer. So they have to rerun it. So the test takes days, which is great.
So are some labs better than others?
It's not
we don't know
yet. We can't say what's best.
Yeah.
Because they're just different.
Wow. And you tested all with the same test, all the titer test.
Yep.
So if a pet parent gets a negative test and they're like, I still think it's valley fever. So should they have it run at another lab then? Like, would that be rational? Like, and for a veterinarian to say, well, let's try this other lab and see if it tests positive, if the sample tests positive there?
Yeah, it's definitely rational.
Yeah.
The problem is, of course, the cost, because it's astronomical at the moment.
Yeah.
Um,
That or just doing like a confirmation test like the EIA that Dr. Jaffe
yes,
talked about. He's
yeah,
like, when you get
definitely.
a negative test, then just do a different test and see if you get the result.
Yeah, there
Wow.
is a difference because it's human read, it's not machine read. Sometimes people can read out the tests differently. I've seen that.
Oh, so it's very subjective.
I'm sorry?
Is it very subjective then? If a human's looking at the color, they're looking at like a color gradient on the
A line.
test, a
A line.
line.
Yeah.
And so they're like, do I see it?
Yeah,
It's like a
exactly.
pregnancy test. Am I pregnant or not? Makes a big difference.
It does.
Holy
So
cow.
yeah, that can change it too.
All right. So that study is coming out soon.
Yes, we did that with the College of Veterinary Medicine at University of California, Davis.
Nice.
So yeah,
Oh my
hopefully
gosh.
so.
Does UC Davis use different labs than we do, or do we all use the same labs?
They have their own cocci lab that they generally
Oh,
use.
okay.
And we know they do run it a little differently, at least for the first part, the positive, negative. They actually concentrate the serum a little bit. So, yeah, you may be more likely to find a positive then. When they're doing
Yeah.
the actual titer test, that is not concentrated. That's like the other labs.
Okay. All right. So they have another lab. Was okay. That's cool. Holy cow. All right. So you also did a test on fluconazole.
Yes. So, what we were looking at with this is how well dogs are absorbing fluconazole from their GI tract into their bloodstream. And the reason we were interested in it is because the data that we have on the absorption of fluconazole dogs is based on two dogs that
Oh
were
wow.
related.
Not
They were brothers.
not a good test.
So yeah, so
Or
that
or not a
that
good
showed
research
great
study.
agreement between the two dogs, but we weren't sure if that was really true. So we enrolled dogs, I think 61 at the end, who had been on fluconazole for at least a month, and it had to be generic, it couldn't be compounded. And we would take an early morning sample before their next pill and then send it for the fluconazole levels to be
So you
read.
measured fluconazole blood levels.
Yep.
Okay.
Our thought was that bigger dogs would not have or would have more fluconazole in their bloodstream because the fluconazole is excreted through the kidneys primarily. And larger dogs have a slower glomerular filtration rate. So we were thinking that the smaller dogs would get it out faster and the larger dogs would have it in the bloodstream a lot longer, which is important because then maybe we need to adjust the dose for larger dogs.
Oh, like based on mass versus weight.
Yeah, that's what we were
Yeah.
trying to see.
Yeah.
It turned out messier than we had thought. There was a surprising lack of consistency on how much fluconazole is getting into the dog.
Wow. So there's all kinds of variables. And we
Yeah,
don't even do you know what those variables are, or are they like an unknown? Like some dogs are absorbing it well and some dogs aren't.
right now we have not found anything looking at the
Wow.
data that we collected for each dog.
You think
I
it's
can't find
genetic?
any.
I think it's like breed
Possibly. I
related.
mean, maybe microbiome too, because it does get absorbed from the proximal duodenum.
Wow.
So it's
So you
really kind of
never
interesting.
know. You
Yeah.
never know if your dog is getting the right amount of fluconazole. So that would be important to know if your dog is not responding to the fluconazole. So before you jump to like itraconazole or some of the more expensive azoles, you want to do a fluconazole blood test and see if they even have blood levels that are going to be appropriate to treat the valley fever. So
Yeah.
would you then increase the dose if they were below the level that is appropriate to treat valley fever, and they're maybe on a high dose like the 10 milligrams per kilogram kind of thing? Would you then increase above the recommended high end of the dosage
So,
for
I mean,
for
theoretically, you could. You'd have
veterinarians?
to recheck and make sure you're not getting into toxic levels.
Yeah,
Um, but
that's interesting.
yeah,
And you
or maybe
just
change brands too.
Oh, so you're just using like the generic fluconazole, like the human stuff.
Right, but there's different kinds of generics.
Ah. Did you check that? Like, did you look at the different generics to see? And so
We Yeah,
you
we did look at
documented.
that. Still working on that analysis, but there did seem to be like some brands that got up a little higher than others. It was strange.
Wow. So it's like a manufacturing thing?
Possibly, or whatever their inactive ingredients are that they're putting in. Yeah, it was odd, but it was interesting.
Wow. So the first research study that came out on the two dogs said that, oh, it's consistent between the two dogs. They have the same levels. Don't worry about it. But
Yeah.
this test is showing something totally different, that dogs have variable levels of absorption of the fluconazole. And so some are going to get better faster than others based on how they absorb it.
Hmm.
Oh my gosh. That that opens up a whole new can of worms.
It doesn't it?
I have so many questions on that.
We keep finding new things that we didn't really want to find.
Yeah. Now you have to do more research, right?
Mhm. Yeah, exactly.
Oh my gosh. That's really cool. Do you have other studies that are getting evaluated?
Those are the only two we have right now.
Okay. All right. And then you had a study on, oh, the cost
The
analysis
cost
study.
analysis.
So you presented the cost analysis study at the 69th annual coccidioidomycosis study group meeting. I love saying that big long, because I finally got it. But you presented that. It was wonderful. That meeting was fabulous. And you presented your research there. You were part of the team that did the research on the cost analysis for pet parents for their dog with valley fever, and it was astronomical.
Yeah, it was.
Yeah. Can you tell us more about that?
Absolutely. So we also did this work in conjunction with Dr. Sykes at the UC Davis vet school. And there are ways to estimate the dog population. Obviously, we don't have a census, but the AVMA puts out demographic information every few years. So you can use that to say, okay, if I have this many households according to the census and this many dogs per household and this percentage of households that have dogs, you can use that to estimate. It's not perfect, but it's something. It's reasonable. So we could get at that information. But what we'd really been missing is how many dogs are testing positive for valley fever. And that data has never been available. We're sort of, we were guessing based on human rates, but it's not reportable in dogs anywhere. So we didn't know for sure. But Dr. Sykes did a study where she got, I think, from 7 different labs across the entire country, she got about 10 years worth of all their cocci tests.
Wow.
I know. She had like 2 million when she started. So they cleaned them and they removed redundant ones. So what we're anticipating is that we were just identifying dogs on their first test. So we're thinking time of diagnosis. That is obviously more complicated because some dogs test positive and aren't really sick. Some dogs test negative, but they are sick. We can't account for everything, but that was at least a number to get us going. And that was recently published in the Journal of Infectious Disease. It's a great paper, for sure. Then we look at the prices, and that's a little hard to find, but there was a reference for that. So what we found is a lot of dogs, like 94% of the dogs that were positive were in Arizona.
Oh, wow. Yeah.
And consequently, 94% of the costs are borne by Arizonans.
Yeah.
We were looking at the six most endemic states. So we had Arizona, California, New Mexico, Nevada, Texas, and Utah. Those are the only states we included. And adjusting for inflation, we came up with 60 to $100 million per year spent to diagnose and treat a dog with uncomplicated valley fever.
Wow. So this was like the first 6 or 9 months of treatment. Is that what you
First,
included?
yeah, we did a year,
A
first year.
year.
So what we
So,
anticipated for follow-ups and repeating tests and x-rays and such, but we didn't include things like, the neurologic dog that needs an MRI or the dog that fails fluconazole and needs posaconazole,
oh my
um,
gosh. So
extra
this
x-rays,
is
anything
just
like that.
your routine valley fever infected dogs without any major complications.
Right.
And
So the
it's
true numbers, we think much higher.
oh my gosh. Did you break it down by like pet owner or dog, or is this just a broad
We
number?
we did for the initial when we were trying to get the costs together. Some I had state level data on costs for some things, so we did have them. Generally speaking, for diagnosis, that was like 5 to 700. And if you think about it, like a lot of Americans, I think over half cannot pay $1,000 surprise bill, and you
Right,
basically use that just to
right.
diagnose the dog. Um,
Yeah. And that's where they'll, if they can afford it, because that's probably like your full blood panel, maybe x-rays and exam.
mhm.
Sometimes if you don't have a lot of money, a pet parent's just going to run a Coxy titer and that's it.
Yeah,
And hope it gives them something.
exactly.
Yeah. So 5 to 700 for initial diagnosis. And then what is it over the year then? Because you have recheck titers, you have recheck exam visits, you have medications, you have also medications for probably other symptoms like lack of appetite or pain. Did you take that into account too? Like when they're
We did
treating
not.
other things?
Yeah, that's a good point. But we did not because we could have no idea how many dogs are getting ancillary treatment.
Right. That's another
So
variable,
it's another thing.
big
If this was,
variable.
it was a baseline, but we included a year of medications. I looked at fluconazole and itraconazole using GoodRx for the prices. Those were actually about the same.
Yeah.
So that added in, and we did 3 recheck examinations, 3 recheck titers, 1 recheck x-rays, and 2 recheck serum chemistries and CBCs. And that ended up, I mean, it's easily over, like 1,500, I think it was about per dog. I mean, it's a lot in a
Yeah.
year to come up with.
So $1,500 a year for maintenance for treating a dog
That, no, that includes the initial diagnosis.
plus the initial. So initial diagnosis and the year of medication and recheck titers is at probably at least 1,500.
Yeah, probably closer to 2,000. Yeah, it was just, it was
Yeah,
unbelievable.
it's expensive. And then, you know, we've unfortunately in practice. Are you seeing pets in practice, by the way?
I am not.
You're not in the trenches anymore.
Not now, no.
So when I was in the trenches in conventional medicine, we would see rescue dogs or dogs coming out of the shelters or the pound, like the county, um, with valley fever, and that's because pet parents would relinquish their pets with the diagnosis of valley fever because they simply could not treat them, like they didn't have the funds to treat them, and so
Yeah.
we saw that a lot. Yeah, and
I
so
talked
and
to, oh, years ago, I talked to someone from PAC, and this was at least 10 years ago, probably. And she said at that time they were getting about 12 dogs per month relinquished for valley
yeah,
fever.
yeah, it's tough. And especially if they have the complicated forms.
Exactly.
I mean, we're just talking about coughing and then feeling lousy for a year when you could have seizures and paralysis and, heart and skin and all the other complications that are just insanely expensive and sad for the whole family.
Yeah, definitely.
Wow. So are there ways to um pet parents to get help with the costs of valley fever? I never thought about that.
Well, I mean, and again, I'm not in practice currently, but I know they have Care Credit or I think Scratch Pay or something like that. Insurance for some dogs has been a lifesaver. There's only
That's
about
true.
4% of dogs have insurance, but in some cases, that has been the
That's
difference between
true.
the dog living.
Yeah. So pet insurance for sure. Yeah, that's a
Mhm.
good point. And then there are actually some studies that pet parents can get involved in. And does that help with some of the costs?
Our study, no,
No.
unfortunately, no. We're not
We need
funded for
some of those.
that. We do need some of those. I would love to have some of those. So the other study that we are currently enrolling dogs for is called the Valley Fever WOOF study. And the WOOF stands for Web-Based Observations, Outcomes, and Findings. And shout out to my husband because he came up with the acronym.
That's an awesome acronym.
It was really
Yeah,
good.
the wolf study.
So for this one, the idea of it kind of came out of COVID because we couldn't see people face to face during the early days, at least. So we wanted to do something that was completely online. So it's a series of surveys. We're looking for dogs who've been diagnosed with valley fever within the last year in any kind, in their lungs, in their bones, wherever. And they fill out an initial survey letting us know what symptoms their dog had and what medication they're on, what tests were run. And then we do follow-up surveys at 1, 2, 3, 6, 9, and 12 months.
So it's a
And
1 year study. It's a
a
1 year
one-year
study
study.
where pet parents are filling out forms and letting you know what's going on. They're updating you on their pet.
Yeah. For the updated, we ask, if the medication has changed or if they can estimate about how much the dog has responded. Like if there was a cough, would you say it's 50% better or totally better? That kind of thing. And we keep track if the dogs are discontinued, and those dogs stay in the study. So if a dog is discontinued at 6 months, but then has recurrent disease at 9 months, we want to pick that up.
Oh, cool. Okay.
So a couple things we found, 87% of the dogs are from Arizona. We were hoping to get a bigger spread, especially with California, but most of our dogs are in Arizona. We do have some dogs that travel. So we have dogs that live in Washington and Michigan and Florida, Massachusetts and Arkansas.
Yeah.
So those are always interesting. And, I'm not evaluating, but I'm listing how the veterinarian is treating it.
Uh-huh.
And so they're just so unfamiliar with it.
Yeah. I get
Which is
calls
scary.
every once in a while from vets from out of state, and they're like, my patient has valley fever. What do I do?
It was the cutest record from a dog where the doctor in Florida, I think, had diagnosed the dog correctly and written out a dose of ketoconazole. And then somewhere between that and the end of the day, they had called a vet in Arizona. And so you see the ketoconazole scribbled out, right? Fluconazole.
And yeah, and the dosing is different with valley fever. We
Correct.
do generally a higher dose than what's in like VIN. So when a veterinarian goes to a website where they can find information on dosing, the fungal infections are dosed a lot lower than the valley fever fungal infection I've found.
Yeah. So currently in WOOF, we have 238 dogs enrolled, and that includes dogs that have completed the year and dogs that are still in our 1 year follow-up. We found, I was taking a quick look at what we had so far. So about 65% of dogs felt generally better by the first month. And we found that most of them, if they're going to have a change in medication, I think we had 17% had to change medication at some point.
Wow.
It usually happened pretty early. the first 3 months somewhere. Either the dog was having a reaction to it or it wasn't helping. There was no improvement in the dog, and they switched medications. We have lost some. Some dogs died due to valley fever. Some dogs died from other things, as dogs do. But, and also with that, we usually find that was within the first couple months. If they were going to go from valley fever, it was pretty early on.
Oh, so the first few months are critical.
Mm-hmm.
Early diagnosis, early treatment, early diagnosis, and getting on it.
Yeah.
Yeah, that's important, even with people. Wow. So, so pet parents can still get involved in this one.
Definitely. We are still looking for more enrollees.
That would be good. So I'll put a link to the WOOF study under this video in the show notes so that pet parents who would like to get involved in this study, get their dog involved in this study, and it's a year commitment, and you fill out forms and updates and just let you know, let Dr. B know how your dog is doing. And so when does this study end? Is there an endpoint?
We're hoping for, it's kind of number of dogs. We're hoping for somewhere between 300 and 400. So we're getting close.
So when you get to a certain level, then you'll follow them for a year and then the study's over.
Exactly.
All right. So everyone get in there and get your dog in there and answer the questions. It's easy peasy. It's something you can do at home. It'll help us veterinarians treat your dogs better, and be able to let you know how they're going to do, because that's what you're looking at, is how fast they're getting better, what drugs they're on when they're getting better. What else are you looking at with this study?
We're looking at so the dose. We're collecting all the dose ranges, which vary. We look at all of their symptoms. So there's the general, lethargy and fever, that kind of thing. But we also break it down by system. So we're looking for dogs that are coughing or have difficulty swallowing because the lymph node's really big. We are looking for neurologic signs. Interesting, red eyes is one of the things that came up a whole lot.
Mm-hmm. Yeah, goopy red eyes.
Goopy red eyes.
And you know what? I've seen that both with valley fever, but also a side effect of the azoles. So It's a tough one. Like, which one is it? Is it the valley fever causing it, or are you having a reaction to the drug? So confusing.
Yeah. So skin disease, bone disease, obviously. We're also keeping track of what the recommendations to the owner are, at least as far as the owner understands them. When are they supposed to come back? What's going to happen then? That kind of thing. So yeah, we're just trying to get a sense of how it's being treated.
Wow. And are you looking at not just the fluconazole or the azoles, but are you looking at the other medications and supplements they're on?
They usually will tell me if there's anything else. There's a spot for it on the survey if there are other medications.
So other medications like your NSAIDs or prednisone or something like that.
Denamarin.
Are you asking about supplements and diet?
We just have that space about it. We do not ask about diet. That's an interesting one, but
yeah,
we didn't put that in there.
Yeah, but you're asking about supplements?
Yeah.
Okay. Cool. Because I think that makes a difference. All the other stuff that you don't necessarily know about, your vet may not know about, all the supplements that you might be giving may make a difference. And then diet would be an interesting one, because Dr. Jaffe did that study on kibble versus fresh food and found a difference in inflammatory markers with that. And so that may determine, how fast they get better or not, based on how much inflammation the diet is causing. So there's so many variables.
There are.
Yeah. So the research studies have to focus on certain things so that they can get, results and be able to record those and so they're accurate. So it's hard. There's so many variables with
it is hard,
especially with valley fever. It's so funky.
it's so well, yeah, and this is um one of the issues with like the wolf study is it's even with our cost analysis, why we couldn't account for dogs with disseminated disease. It presents every which way. I mean,
Yeah,
almost everything a dog comes in for is going to trigger the thought of valley fever.
right. Yeah, anything weird in Arizona is could be valley fever. Anything.
Yeah, definitely.
Yeah, it's wild. Yeah, valley fever is it's tough to research. How did you get interested in research on valley fever? Just because you saw a ton of it when you got here?
No, it's a funny story. I was working at a veterinary clinic and I worked every other Saturday. And they told me the vet who worked the alternating Saturdays did research on valley fever. And eventually we ran into each other. So that's how I met Lisa Schubitz.
Ah,
And then at that time, we were working on the epidemiology study we did in the early 2000s. And she needed someone to help manage that. So I ended up helping with that, got interested in it, um, and then ran out of funding for that. We got it done
oh,
and it's
darn it.
published, but we did run out of funding. So
Yeah.
I went back into practice. Um, but in the meantime, I had gotten so interested in the epidemiology and statistics, I went back and got a master's in public health.
Oh my gosh, that's awesome. Good for you. Holy cow. So you went back to school, got a master's degree so that you could focus more on research.
Mm-hmm.
Oh my gosh. That
Yep.
took you in a whole different direction.
It
So you
really did. Not
started
at
as
all.
you started as a general practitioner, a veterinarian that worked in a vet clinic, just saw everything. And now you've specialized in research and particularly valley fever. Wow. Yeah, we need
Yeah.
more researchers.
It's not at all where I expected I would go. But it's been so interesting.
Yeah, it's fun, huh? It's complicated.
It's complicated. And I get to see results first, and I'm nosy like that.
That's so cool. That's a really interesting study how you got involved in research. So valley fever changed my life, and that's why I'm on this mission to get all this information out there because I've treated pets with valley fever for 35 years. And then I had it 40 years ago and then got it again last year horrendously and lost two dogs to it and um two or three of my other dogs got ill from it. Like it's just valley fever really touched my life and I was like I need to just talk about it. I need to talk more about valley fever because apparently with my experiences that's what the universe wants me to do is get information about valley fever out there for pet parents and people too.
Yeah,
Yeah.
definitely. I'd love to see more funding to come for some of the veterinary research. There's not
Oh,
even
for
much in
sure.
human research, but there's even less in animal research.
Yeah. Yeah, we need more funding. Um is that something that we would send people to the Valley Fever Center for Excellence site
There
for
is we have
sponsors
a
and donors and stuff?
we yes, there's a foundation through the Valley Fever Center, and there is part of it is set aside if somebody wants it to go specifically to animal research,
To animal
dogs.
research?
Yeah.
Okay, I will put that link in the notes.
Okay.
And um, for the Valley Fever Center for Excellence to be a sponsor or a donor, and you can say that you want it to go to animal research or to
Yes.
research for dogs with valley fever. That would be awesome so that you guys can do more research.
Yeah.
Yeah. Have you had valley fever?
I have not.
Oh,
Um,
knock on wood.
yeah. I work with it in the lab as well, obviously. So a few years back, they skin tested all of us, and most of us were negative.
So are you working with like cultures of it?
Mhm.
Oh my gosh, that's like so infectious. Do you wear like
I'm
the
not.
hazmat suits and stuff to
Um,
deal with the
you either have to wear
cultures?
an N95 or one of those things that goes over the head.
Yeah,
Um, but we only handle it like in a hood, so it's not blowing back at us. I would never open anything in
yeah.
the air.
Because isn't that how someone like back in the early 1900s got it? Is
Yeah, that's
they were
exactly.
culturing, they
Yeah,
were
as a medical
culturing it.
student, and he
Yeah.
opened up the plate and got it, and they like sent him to. I think he was in California. They sent him to Arizona to die because at that time they thought everybody died from it.
Oh my gosh. Yeah, that's crazy. Oh, I didn't know you worked with the actual cultures. Holy cow. What studies are you doing looking at actual cultures?
Right now, a lot of immune system work.
Oh,
So, what
wow.
part of the immune system is reacting when it's coming in, how the body is responding, that kind of thing. It's interesting.
So are you looking at like cellular stuff?
Mhm.
And are the studies like with like cells, like you're exposing cells to the fungus and
Yeah,
finding like
some of
the inside of the cell kind of stuff, like how it reacts to
yeah,
the fungus? Is that what you're
yeah.
doing?
The immunology immunologist we work with, Dr. Powell, has starting to do some research on, is the does it stay outside the macrophages? Does it get into the macrophages? That kind of thing. And it's really fascinating. There was a lot of really
It
good
is.
research presented at Coxie Study Group.
Yes, I was there. And that was just, it blew my mind because they were showing pathways inside the cell and how they could use things to block certain pathways. And I'm like, holy cow, there's like this whole world inside a cell that you just don't realize. And researchers are studying all these pathways to see where they can change things so that you don't get valley fever or that you can get rid of valley fever or something. They're trying to figure out ways intracellularly to do things. It's just crazy.
It is. Yeah, I have a lot more respect for the immune system. I don't know how we're all walking around without
Yeah.
constantly getting infected with terrible bacteria and viruses.
Yes, our immune system is smarter,
Yeah.
smarter than we know. Yeah. So you're interested in immunology as well. Is that
It's
where you got your master's in immunology?
No, I got my master's in epidemiology.
Epidemiology. Okay.
So, yeah, I mean, I took immunology back in my first year of vet school. So this was a very long time ago.
Well,
And
yeah, we did, but immunology is nothing like it is now.
no, I know it's completely
Like 40
different.
years ago when I took it, they didn't know this stuff. Like we didn't know
Exactly.
what mitochondria was 40 years
So
ago.
I'm playing a lot of catch up. I'm trying to learn what's going on. But Dr. Powell's very patient.
Wow. Yeah, so much to do in immunology, and that's going to make a difference with valley fever because it valley fever evades the immune system.
Yes.
Like it's just a bizarre organism, a fungal organism that can go all over the body and then the immune system sometimes doesn't see it. And isn't that why we have negative tests is because the immune system is not seeing the fungus?
Part of the immune system is still seeing the fungus.
Yeah.
So we use the antibodies for a test because that's what we have that we can measure. But it seems like T cells are really important and how the immune system actually responds. Another thing, when a dog tests negative but is sick, they just may not have enough antibodies. It may be below the detectable limit of that test.
Right. So can you test T cells?
We're looking at that too.
I have so many questions. That would be cool is to check T cell levels to see what's going on with the infection or whether they have the infection and how they're reacting to it. And if
Yeah.
they have enough immune capability to fight the infection based on your T cells.
Yeah. Dr. Shubitz just got a paper accepted. She's first author on it, looking at that T cell response. Some in just community dogs that have had valley fever, including mine and
Yeah.
hers. um, so that should be coming out in the American Journal of Veterinary Research soon.
Oh, cool. So you did like blood samples from dogs that had valley fever to find
Mhm.
out their T cells and stuff?
to see how they're reacting and seeing if there's a difference between them and naive dogs.
Yeah. Nice. Um, yeah, I like the research on patients, like dog patients, because I think that is practical. And it's hard, when they're doing the cellular research or the like mouse research, it's hard to know, does that transfer to dogs, and does that mean that it's going to work in people? Like,
Exactly. Yeah, definitely.
no, are we like rats? I don't know. Yeah. So I like the dog stuff. The research where we're following our patients and seeing how they do and drawing blood and figuring out, you know, what's going on inside their body and why.
Yeah. I would love to be able to have an assay to predict which dogs are likely to get really bad disease. So you
Yeah.
can be more aggressive right at the beginning, and which dogs are going to, manage fine on their own, maybe cough for a few months
Yeah.
and then be over
So
it.
which ones are going to get disseminated? Aren't they working on that kind of study in humans to see who get who?
Yes. Yes.
Yeah. Wasn't that one of the ones that was presented? That sounds really familiar on who would just get over the valley fever no problem and who would go on to disseminate.
Yes. They've been looking at mutations in people
Yeah.
to see if they can identify what puts people more at risk of bad disease.
Yeah. And that's something that, yeah, we should look at in dogs and cats and um, our little furry friends and see, and because that's going to make a difference how aggressive you get right off the bat and
Mhm.
all the things that you're going to do for treatment and maybe even the dosage that you're going to use. You're going to use the higher end of the dosage if you can, if you've got a dog that would be more prone to disseminate, which means it goes to other parts of the body besides the lungs. What I found really interesting when I talked to Dr. Galgiani is people get the the lung problem where they lose part of their lung, and we
Yes.
just I haven't seen that in dogs, and I don't know if it just doesn't happen.
I have seen a couple dogs that did get nodules from the lungs removed.
I've seen nodules, but not
Yeah.
like where it just melts, like it
Yeah.
just disintegrates the lung. That's kind of a like a human um, problem with valley fever that I haven't seen in animals. It's weird.
It
So
is weird.
valley fever acts differently in different species, whether it's
Oh,
people,
definitely.
dogs, or cats. Like, and even cats, it acts differently. Like cats get it in the skin and the bones. Those are what I've seen. Um, are you
Yeah,
doing
cats
any
are.
cat studies?
Oh, well, we have one published already.
Oh, tell me
So
about it.
what we found in that one is that cats are definitely more likely to be disseminated by the time they get diagnosed. And we don't know if that's because the cats are hiding their symptoms better or people are like, it's a cat, things are fine until the cat gets really
Well,
sick.
yeah, cats sleep 22 hours a day. So do you
Yeah,
know?
lethargy is hard to define.
Yeah.
Um, so, yeah, most of them were disseminated. Most of them had very high titers. And that's one thing we really don't know. Like, are cats walking around with titers, but not disease? We really have no idea.
Wow. That is another research study that needs to be done. Another woof study, but you'll have to name it differently. The meow study.
And animals like alpacas and llamas get super sick, like really, really sick. It just spreads everywhere.
Isn't that strange how different species respond differently? Like, what the heck is different about the different species? Holy cow. Yeah, we need to do more cat stuff because back when I was first seeing valley fever and had cat patients, they said, "Oh, it's not curable in cats." I mean, it's hard to cure. Like it. Do you consider it non-curable in animals like we do in people?
I tend to tell people that if their dog responds well and we're thinking about stopping medication, that we would consider it more of a remission situation
Remission. Yeah.
and we need to follow up.
Yeah. Back in the day, they said that cats you couldn't get into remission. And I was like, oh my God. So what do you do? But Have you seen, did you see cats when you were in practice?
I did.
Yeah. How did they do?
Most of them actually responded pretty well.
Yeah. I
Were
haven't
feeling
seen a
better
cat in a
right
long
away.
time.
Yeah, it doesn't seem to be as common in them. So we use dogs more.
Yeah.
It's a better marker for human disease. If
Yeah.
somebody gets infected and their dog gets infected, that kind of thing.
Yeah. Wow. So, yeah, I don't know what we would do with cats. That would be an interesting study, is just to draw blood from cats and see if they had a titer.
Yeah.
And because then what do you do if they're and and like, are they symptomatic or not? Because it's really hard to tell with cats.
It is hard to tell with
Unless
cats.
they're really sick and obviously sick, they could have a significant titer and be lethargic, but you don't really know what lethargic is in a cat that sleeps 22 hours a day. That's a tough one. I bet a lot of cat people would like to get involved in that. Well, maybe. I don't know. You
I would
probably
love
need
to be able to do
do
that at some
yeah,
point.
yeah, do the kitty cat test. Do you have like case studies on cats that are published?
Um, Published. Dr. Shivitz definitely has some published. Um, she is a really cool one where it had disseminated to the cat's tongue and paw. It's great pictures.
Holy cow.
That one's it's a little older. I would have to look it up to remember
Oh
where
my
it is.
gosh. Yeah,
And
I'm gonna look it
Dr.
up.
Dial. Oh, you know what? She never got that published. I have I have a manuscript, an unpublished manuscript, of Dr. Dial looking at the disease in cats. It was similar to what we found in our study.
Yeah, with weird locations.
Weird locations and cats being very sick by the time they're diagnosed.
Gosh. Yeah, I think it's just cats hide their illness, and it's hard to know
Definitely.
because they can be picky with food, and that can be just them.
Yeah. We did look at indoor outdoor cats, or cats that spend, part of their day indoors and part outside. And we couldn't find any relationship between that. The indoor cats were as at risk
Wow.
as the outdoor cats.
That's interesting. So the spores are getting in our house.
Yeah.
So they're going in through the vents and getting in our house, or going in the windows when their windows are open. So the spores are just in the air, wherever. And you never know where they are. Because even if you look in places where you think they should be, they might not be. That's another research study that's being done or has been done. Is like
Yes.
looking at different locations and trying to figure out where the fungus actually lives. Like there's nothing, you can't pinpoint it.
Yeah.
Yeah. Valley fever is weird. It's a weird thing.
It is.
Excellent. Well, I so appreciate you joining me today on Valley Fever Voices podcast. And I will post the information for the WOOF study below the video in the show notes so that pet parents can get their dog enrolled for the year and fill out forms online and let Dr. B and her group know how your dog is doing. And so we can better treat your dog and any dogs that get valley fever.
Yeah. Thank you so much.
The research will be shared far and wide.
Hopefully.
Yes. All right. Thank you, Dr. B. It was a pleasure talking to you. I had a great time, and hopefully we can do this again.
Okay. Thank you so much. Hopefully I'll
welcome.
have more studies done by then.
Oh, okay. Well, we'll wait for more studies and then we'll do this again.
Okay.
All
Sounds
right.
good.
Bye, guys.